Did you know that Coca-Cola was created in 1883 by a pharmacist to treat different illnesses such as headaches? It's crazy to think that what was once used as a medication we now enjoy as just a regular drink. When questioned what a pharmacist is, one might think that it's a simple job where you count and dispense pills, but there's a lot more to it than you might think. A pharmacist is an individual who is trained to dispense medications to patients and provide advice about the safe usage of medications. Pharmacists can work in drugstores, grocery stores, hospitals, nursing homes, clinics, and other patient care venues. All pharmacists, no matter what field you go into, require the same amount of education, which is 2 years in prerequisites, which you obtain at a university, and 4 years of pharmacy school. Although pharmacy requires the same amount of education, all the fields are very different. And today I will be comparing retail pharmacy and clinical pharmacy. Retail pharmacy is one of the more common types of pharmacy. They work in grocery stores and in drugstores. A typical day as a retail pharmacist is they receive medications, they receive prescriptions from doctors, and they count and dispense these pills to different patients. And it is very important for doctors and pharmacists to communicate with each other so they make sure that the patients are receiving the right medications in the correct dosage. A retail pharmacist can work in chain or private companies. An example of a chain pharmacy would be CVS or Walmart, and a private pharmacy is privately owned, and an example would be MediDrive in Canyon. Although retail pharmacy is well known, it is most certainly not the only type of pharmacy. Clinical pharmacy is taking place in a much different environment than retail pharmacy. The work environment for a clinical pharmacist is they work in hospitals, clinics, nursing homes, and other patient care venues. In hospitals, the pharmacist will travel with a group of physicians during rounds to evaluate each patient. And what rounds is a group or a team of physicians travel to each patient and they discuss their care plans, they talk with their patient, and they discuss their medications and evaluate if they're working or things that they could do differently to improve their health. In nursing homes, pharmacists travel to each patient and dispense their medications to them. It is especially important for pharmacists to be in nursing homes because typically the patients take multiple medications, and a pharmacist's knowledge of the different drug interactions is very important. A pharmacist can be very valuable in healthcare settings because of their extensive knowledge on drugs and their different interactions with each other. Although both retail pharmacy and clinical pharmacy are in charge of the medication for the treatment of patients, their roles are very different. Clinical pharmacists help doctors with their extensive knowledge of drugs and their interaction, and retail pharmacists communicate with doctors and dispense drugs to their patients. By working in different environments, they're both able to provide specific knowledge to help patients heal.